Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni Dhal. Let's look at today's daily bulletin. Chhattisgarh Medical Council has suspended the license of a doctor for 3 months after finding him guilty of treating a patient without anesthesia without the requisite registered qualification of an anesthesiologist. As per the Medical Council order, the doctor has an MBBS degree, but despite not having the additional qualification of an anesthesiologist, he has been found guilty of treating the patient in that discipline. Therefore, the medical license of the doctor has been suspended from 11th of October to 10th of January 2023. The doctor was serving at Shaheed Hospital, Dali Rajhara. Days after the AIIMS New Delhi strictly banned the entry of various kinds of touts and agents of private hospitals, laboratories in its premises, the adjacent Safdarjung Hospital has now come out with a similar notice. The Bardhaman Mahavir Medical College and Safdarjung Hospital has released a notice for unauthorized persons from private establishments exploiting patients in this medical institute. Just like the AIIMS circular, the Safdarjung circular also holds the doctors and faculty in charge for the presence of unauthorized persons or agents in the hospital. Gambia government on Friday said the number of child deaths from acute kidney injury thought to be linked to Indian-made cough syrups has risen to 70 from a previous toll of 69. President Adama Barrow gave the update at an emergency cabinet meeting which he convened on Thursday to discuss the crisis. The syrups were found to be made by New Delhi-based Maiden Pharmaceuticals Limited, which has since had one of its factories shut down in northern India as health authorities they are investigating.
Researchers linked meteorological history in New York State with data from over 1.1 million emergency room visits during 2005 to 2013 and found higher emergency room visits for kidney-related problems such as acute kidney injury, kidney stones, and urinary tract infections during days with extreme heat exposure. Given the increasing frequency and intensity of extreme heat exposure due to climate change and the growing prevalence of kidney disease worldwide, researchers examined their association with one another. They examined the association between extreme heat exposure and kidney disease-related emergency department visits based on seasons and disease subtypes in New York State. In their paper published in the American Journal of Kidney Diseases, extreme heat exposure was significantly associated with an increased risk of ED visits for multiple types of kidney disease, mainly acute kidney injury, kidney stones, and UTIs. Furthermore, the impact of extreme heat exposure lasted a week and was stronger in the transitional months, that is May and September, than the summer months, that is June, July, and August. Use of an older class of type 2 diabetes drugs called Glitazones, also known as thiazolidinediones or TZDs for short, is linked to a 22% reduced risk of dementia, reveals a long-term study published in the open access journal BMJ Open Diabetes Research and Care. Because type 2 diabetes and dementia share some of the same physiological patterns, researchers have started to look at whether diabetes drugs might also help stave off or treat dementia, but to date the findings have been inconsistent. For the study, the researchers compared dementia risk in older people with type 2 diabetes and treated with either a sulfonylurea or a TZD with those treated with metformin alone. They drew on the electronic health records of more than 5 lakhs people diagnosed with type 2 diabetes from the National Veteran Affairs or VA health system spanning the period from January 2000 to December 2019. Only older patients aged at least 60 and given a first prescription of metformin or a sulfonylurea or a TZD between January 2001 and December 2017 were included in the study. Their health was tracked for an average of nearly 8 years. After at least 1 year of drug treatment, use of a TZD alone was associated with a 22% lower risk of dementia from any cause, compared with the use of metformin alone. Specifically, it was associated with an 11% lower risk of Alzheimer's disease and a 57% lower risk of vascular dementia. While the risk of dementia from any cause was 11% lower from the use of metformin and TZD combined, it was 12% higher for the use of a sulfonylurea drug alone, prompting the researchers to suggest that supplementing a sulfonylurea with either metformin or a TZD may partially offset these effects. Further in-depth analysis indicated that those younger than 75 benefited more from a TZD than older patients, highlighting the importance of early prevention for dementia, noted the researchers. And these drugs also seem to be more protective in overweight or obese patients. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.